Hello everyone. In this video we are going to discuss about Lyme disease. Lyme disease. Lyme borreliosis, also known as Lyme disease, is a common vector-borne. It is originating from genus species which is Borrelia burgdorferi sensu-lato complex. This pathogen is being passed on by ticks from the Ixodes ricinus complex, penetrates into human dermal tissue, and cause a local inflammatory on human skin. Typically, it will transmit through the bite of infected ticks. It started by binding to any part of human body. If left untreated, it will cause severe defined fibromyalgia-like illness. Post-treatment Lyme disease unresponsive to continuous antimicrobial therapy. The epidemiology of Lyme disease infected in humans is characterized by the geographic distribution as well as the life cycle of the tick's vector and genus species. Ixodes ticks possess 3 life phases requiring the infected host's blood, which is larvae, nymphs, and adults. The ticks can be invaded by Borrelia burgdorferi at any phase during the development of adult ticks. Upon the invasion of Borrelia burgdorferi infection penetrating the skin via tick bite, the pathogen will roam locally around the bite area for approximately 3 to 32 days of infection. Borrelia burgdorferi will travel through the lymphatic system leading to regional adenopathy, or dissemination in the blood to tissue, organs, and other skin sites. Primarily, an inflammatory response will arise significant prior reaction to the infection. Lyme disease's signs and symptoms are classified into 3 stages: early localized, early disseminated, and late. However, Lyme disease's early and late stages are generally divided by an asymptomatic interval. In the lack of particular antibodies, an antigenic variability affected the pathogenicity of Borrelia burgdorferi. Borrelia burgdorferi can be transmitted to various tissue of the mammal's host, especially the blood circulation system, lymph, as well as the peripheral nerves of the hosts. At the site of the tick's bite, inflammation occurrence is the most common visible symptom, which also specified that the dissemination is more efficient and effective in tissue better than in the blood. This pathogen endures adhesion upon the endothelial cells of the host and the extracellular matrix, and migrates between each cell layer within the host cells. The existence of Borrelia burgdorferi within the extracellular matrix and consumption of lymphocytes B and fibrocytes of the host conceal this pathogen from the body defense system of the host, as well as antibiotics medications. Alteration on the surface antigens allows Borrelia burgdorferi to evade the eradication of the initial phase of the infection occurred. This pathogen is also capable of demolishing both T and B lymphocytes, thus impairing the phagocytosis mechanism inside the host. Clinical manifestation of Lyme disease is characterized upon the contributing pathogenesis of Borrelia burgdorferi and sign and symptoms of this disease. The sign and symptoms of Borrelia burgdorferi infection can be classified as according to stages of Lyme disease development. If symptoms persist, red macular abscess, inflammation, and pain at the site of infection, then it is determined that the infection has developed to early localized stage. If symptoms such as flu-like syndrome, fatigue, fever, stiff neck, chills, and myalgias, then early disseminated stage has begun. If left untreated, symptoms such as arthritis, swelling, and pain of joints indicated late stage of Lyme disease. As time goes, the treatment and technologies involved in the treatment are also advancing and improved in order to provide the best treatment for the patient enduring the disease. The diagnosis for Lyme disease is quite hard because the signs and symptoms are similar and often be found in other diseases as well. The treatment starts by a thorough review of our health history, where the patients will be asked a few questions about various possible factors that might contribute to the disease. Some of the factors including the patient's living area and signs of tick bite. A physical test will also be performed to check for any signs of disease such as rashes and joint pain. However, since the symptoms are similar to other diseases, the healthcare professionals will do further lab tests to determine whether the symptoms on the patients are really related to Lyme disease or not. One of the lab tests to confirm the presence of Lyme disease is enzyme-linked immunosorbent assay. ELISA test is conducted to detect antibodies against the bacterium Borrelia burgdorferi B. burgdorferi. However, it can sometimes produce a false positive results. Therefore, the test alone cannot be used as the basis of the diagnosis. Another test in the diagnosis is called Western blot test. This test is conducted as a confirmation test to see whether the result produced by ELISA test is accurate or not. Cultures biopsy from secondary tissue lesion might also be tested. If positive, then the dissemination stage of Borrelia burgdorferi can be proven. Moving on into treatment of Lyme disease, the treatment of Lyme disease is based on several antibiotics. It is because Lyme disease is caused by a bacterial infection. For adults that are infected with Lyme disease, the first-line treatment of medications used is doxycycline, which is a derivative from tetracycline. Also, penicillin-like antibiotics, such as amoxicillin and ceftin, which is a syphilis-borne antibiotic, also have some activity against Lyme disease. For children that are under 12 years old, general practitioners usually use amoxicillin because of the possible side effects of doxycycline in small children. The second line of antimicrobial agents used to treat Lyme disease is cefuroxime axetil. Cefuroxime axetil is prescribed and recommended to patients that are not suitable for taking doxycycline as a treatment. The third line antimicrobial that is being used in treating Lyme disease are macrolides. All guidelines approved and recommended to use macrolides such as azithromycin for the treatment, especially patients that contraindicated with doxycycline and amoxicillin. Lyme carditis can happen when the Lyme disease bacteria enter the tissue of the heart. It may result from the disturbance of normal movement of electrical signals from the upper parts of the heart to the lower part that are responsible for heartbeat. Patients with these conditions need to be hospitalized and treated in hospital because of concerns of worsening heart block. Patients also need to be provided with a heart pacemaker. Patients that are not hospitalized can be given with antibiotics such as ceftriaxone. Ceftriaxone may be changed to doxycycline back if the cardiac condition improves and pacemaker is not needed anymore. Lyme arthritis could happen when the Lyme disease bacteria spread and enter joint tissue and cause inflammation. If not sought for treatment, permanent damage to joints can occur. If patients have Lyme arthritis, oral treatment such as amoxicillin and doxycycline can be given as treatment for 4 weeks. Acrodermatitis chronica atropicans is a chronic event of Lyme disease bacteria. If left untreated, acrodermatitis chronica atropicans can cause episodes of chronic inflammation that can lead to neuropathy, arthralgias, and cutaneous malignancy. For the time being, there is no further research and non-randomized control trials have been performed on patients. The guidelines recommended oral antibiotics such as doxycycline or given antibiotics with parenteral routes. The primary approach to prevent Lyme disease is to raise awareness in public and also healthcare professionals about the infection connected with tick bites. Plus, primary prevention was also promoted on how to avoid the habitats that produce tick cycle. Other than that, one way to prevent tick bites is by wearing proper clothing when doing activity outside, especially in the bush or forest. Secondary prevention involves the inspection of the body as whole and get rid of any attached ticks in the body. The popular body parts that tick favor are especially at skin folds, armpits, and back of the knees. Besides, a thorough check in children's scalp, neck, and the back of ear also should be made, as this area is easily missed. If having a tick bite after thorough check, immediately remove using tooth tweezers and gently pull upwards. Individuals whose ticks have been removed need to thoroughly monitor if they have erythema migraine symptoms or hot ring circular when touched at the site of the tick bites after several weeks. And that's all about Lyme disease. Thank you for your attention and don't forget to support us. #PlanetHim.